Hi, I'm Chapel Taylor Olson, and I am an RN, and talking to you today about the representation of nurses in popular culture. It's just an overview of what we're going to talk about today. When you think of nurses, the name Florence Nightingale likely comes to mind. You probably think of women. There are a lot of hats involved, possibly some skirts as well. Maybe the nurse in your mind gets to wear scrubs, but basically, there's a lot of focus on costuming. We think of Florence Nightingale as this gallant noblewoman, inventor of modern nursing, giving selflessly to heal wounded soldiers. You have likely heard her called the lady with the lamp, and picture a lamp like this. Well, she never used a lamp like that. She may not have used a lamp at all, but if she did, it more likely looked like this. And she never would have had to invent modern nursing if these folks hadn't destroyed it in the first place. The earliest individuals recognized as nurses included women like St. Helena and St. Marcella of Rome. Highborn and wealthy, these women had the time and resources to develop the first Western world versions of hospitals and long-term care facilities. Phoebe, who's referenced in the Bible by Paul, is known as the first visiting nurse. Care of the sick and infirm was a primary part of Benedictine monastic life. This early nursing care was as likely to be performed by men as by women. For wounded soldiers, there were knights whose job it was, their dedicated task was to perform nursing care. These individuals were highly revered and valued, conditions were clean, and the role was not gendered. During the Protestant Reformation, that all changes in Europe. These monasteries that were providing nursing care were forced to close, and the care that was provided by them ended. Public hospitals replaced them, and they were chronically filthy, understaffed, undersupplied places where people went to die out of a lack of choices. To address staffing problems, judges began giving women who were in trouble for prostitution, drunkenness, and poverty the opportunity to work in the hospital instead of going to jail. The image of nursing suddenly changes dramatically in this period. These women had no training in nursing. They were there out of desperation themselves. But we suddenly see nurses associated with stealing from their patients, taking payment in alcohol, and performing sexual favors for their patients. And it's in this era that we see a switch to perceiving nursing as women's work. And the presence of men in nursing is basically over. It's into this world that Florence Nightingale is born. She showed an interest in nursing starting at a young age and sought out a formal nursing education at the age of 31 in Germany, despite her mother repeatedly forbidding her from going into nursing. Florence's family didn't want her to go into nursing because it was akin to prostitution. Nightingale did do incredible work in this field, but not because she was a generous and giving woman. She was important because, as a scientist, she was able to see the impact that sanitation had on health. As an educator, she pushed for formal education to be a part of the nursing process. And as a statistician, she was able to track the impact of what she was doing and prove to others that she was right. I like to think of Florence Nightingale as the first nurse to be misrepresented. Henry Wadsworth Longfellow, the American poet and wildly popular creator of popular media like Paul Revere's Ride and the Song of Hiawatha, created the label the Lady with the Lamp, which is still a common way for Nightingale to be referenced today. He wrote Santa Filomena about Nightingale in 1857, and it was published in the very first issue of Atlantic magazine. The Crimean War, where Nightingale gained much of her experience, ended in 1856, so this poem comes hot on the heels of her appearance on the international scene. He writes, "A lady with a lamp shall stand in the great history of the land, a noble type of good, heroic womanhood." He turns her academic, science-based, well-educated work into noble good and equates it with womanhood. Throughout the poem, he uses words like flit to describe her, and it says that seeing her, soldiers dream of bliss and turn to kiss her. He writes, as if a door in heaven should be opened and then closed suddenly, the vision came and went. He doesn't depict her as doing anything but flitting around and making men feel good. He gives her a catchy alliterative name, the lady with the lamp, and it takes off. But he misses entirely what she was actually doing to revolutionize nursing, and this pattern of misrepresentation of Nightingale continued. A 1912 film about her shows her hiring nurses with no experience, despite the fact that the real Nightingale openly discouraged women from going into nursing for the wrong reasons and only hired women for her team that had extensive nursing experience. Many other nurses came after Nightingale and further defined the field, but what nursing is and what it is not is still a question being asked and answered today. These three main aspects of nursing come up again and again and are constantly contradicted by the representation of nurses in popular media. Nurses are highly educated. Most American nurses hold at least a Bachelor of Science degree in nursing, and many have master's and doctorate level degrees. Nurses receive a science-based education, and their licensure and continuing education is required to stay on top of an ever-changing field. Many nurses are involved in conducting scientific research. We also work autonomously. Nurses report to management level nurses, not providers. We conduct assessments, evaluate our patients, and make recommendations to providers independently. We are not providers' assistants. Generally, the media portrayal of nurses is stuck in stereotypes, and the four main ones are the angel, the handmaiden, the battleaxe, and the harlot. There are others, but I believe they can be seen as subtypes of these four, which are most commonly referenced in the other research. Overall, the portrayal of nurses is statistically more negative than positive and overwhelmingly inaccurate. Nurses identify misrepresentation of the field as in media as one of the most defining reasons why nurses continue to be misunderstood and underutilized as medical professionals. The angel stereotype is the nurse that is just so giving and sweet. Her patients recover because of her tireless effort and almost magical ability to bring them back from the brink of death. It links directly back to Longfellow's description of Nightingale as heroic womanhood that comes through a door in heaven. One of the first ever talkie biopics from 1936 was about Nightingale and was entitled The White Angel. This portrayal could seem like an exclusively flattering portrait. However, it is also one of diminished power, of subordination, servitude, and even abuse. Many nurses and researchers found that this stereotype was highly prevalent during the peak of the COVID-19 pandemic and led society to overlook how nurses were victims of governments that were literally putting them in harm's way without the necessary support. In the TV show, Bob Hart's Abishola, Bob's first words to his nurse Abishola upon waking from surgery following a heart attack are, "You're an angel." Despite still being groggy from anesthesia and recently close to death, he immediately begins to retake his position of power with Abishola as he asks her about what kind of socks she is wearing and says that they aren't good enough. He owns a compression sock company and she wears the competitor's brand. This stereotype conflicts with the concept of nurses as educated and science-based because the angels' powers seem to come from some otherworldly source. It is their love and compassion that heals their patients, not their knowledge and skill. Many patients and even student nurses do not know what to expect nurses to be able to do, and researchers find that people cannot describe what a nurse does without comparing them to doctors. When people do define a nurse's role, it is often boiled down to handling bodily fluids, dispensing medication, and performing basic care. Students often find that their families and friends fight against their decision to go to nursing school because it's seen as nothing more than wiping bottoms. The role is seen as boring, repetitive, unimportant, and has limited potential for advancement. In this set of comic book frames from Marvel's Night Nurse, we see Christine Palmer in absolute ecstasy over her role of handing things to the surgeon. "I never knew I could love surgery so much until I worked with him," she says as she hands him tools. In this version of nursing, all we see nurses do is assist doctors. They take orders, answer phones, and basically do nothing until they are told to. This undermines the concept of nurses as well-educated and autonomous professionals. In reality, nurses conduct their own assessments on patients. We get orders from doctors, and it's on us to make sure that they are correct and appropriate based on assessment of the patient at the time of administration. Nurses can be sued for care that caused harm, even if it was following a doctor's order. Bossy, demanding rule enforcer. The Battleaxe nurse is far from the angel in terms of power, but is also often portrayed as far removed from any image of healing. Nurse Ratched from One Flew Over the Cuckoo's Nest is the most prominent version of this type of nurse. Her hair is always perfectly fixed, her uniform is perfectly white, her hat is in place, and she keeps the ward that way too. Nothing else much matters. This image of nursing does show nurses as autonomous, but that autonomy leads only to poor patient outcomes because they act without oversight and without regard for patient well-being. If you look through Reddit threads or fandom sites about Nurse Ratched, viewers talk extensively about how awful it is that she performed electroshock therapy and ultimately a lobotomy on her problematic patient McMurphy. However, she's not in the scenes where electroshock therapy is performed, and as a nurse would not have performed this surgery. Because she is a Battleaxe nurse, she is blamed for all of the problematic care that is provided at this psychiatric hospital. She is okay. Because she is depicted as a Battleaxe nurse, viewers blame her for all of the troubling care that is provided at this psychiatric hospital, without thought for what would have realistically been within her scope. BuzzFeed puts her in the top 10 worst villains of all time and claim that she's so bad that viewers don't want to watch her movie anymore. The American Film Institute has her at number 5. Being a bad nurse makes you one of the worst villains of all time. HalloweenCostumes.com claims that it has costumes that will allow you to become one of the most important healthcare professionals, and states that it has costumes for both men and women seeking this prestige. However, here are the top 12 results in adult nurse costumes. Our classic Florence Nightingale tops the list, then the Battleaxe fake nurse from Kill Bill, then 10 different versions of Sexy Nurse. In Longfellow's poem, he talks of soldiers seeking to give Nightingale a kiss. The connection of nurses to women, the sexualization of women, the intimate care provided by nurses. There are many factors that could contribute to the concept of the harlot nurse, but this may be the most prevalent version of nurses in popular media. The nurses on ER and Grey's Anatomy serve basically as just the doctor's dating pool. Bob Hart's Abishola is entirely about a man falling for his nurse and seeking to form a relationship with her after discharge. The movie In Love and War, the first movie that I ever spent my hard-earned allowance dollars on, is all about a soldier and a nurse falling in love. In all of these stories, even when they begin with an element of actual nursing, as they become more about the relationship, we see less of the presence of the nurse as an educated, science-based, autonomous professional. They are diminished only to love interests. Marvel Comics introduced Night Nurse as a title that could attract more female readers. It ran for only 4 issues beginning in November 1972, but it made a much bigger impact on the Marvel Universe than its short run would indicate. In this comic, readers follow 3 different characters as they attend nursing school and begin their nursing careers, and all the while they room together. I just really love this cover. There is so much going on here. We already see this conflict between our main character, Linda Carter's role as a nurse and her role as love interest, and so she can't possibly be both. There are nursing supplies strewn all over the ground. Something seems to have happened to this gentleman down in the corner, though I'm not sure what. Up in the upper corner, we see Linda Carter and her corner box image just openly crying, just tears dripping down her face. The corner box is usually a place where the hero is shown at their strongest, but this is how we depict Linda here. This is truly a great first issue, as it tells us. I could spend this whole talk analyzing Night Nurse. It's fascinating, but this panel from the first issue really gets me. The nursing instructor says, "You young women can expect to work harder than you have ever worked or probably will ever work in your entire lives. Now we will discuss the proper assembling of the nurse's uniform." And Linda Carter is here for it. If I can't love my roommates, I can at least love my classes, she thinks. The nursing material, what little there is, quickly gives way to a romantic storyline where for Linda, where she gets involved with one of her first ever patients and falls into the harlot stereotype. I used different panels from Night Nurse issue to illustrate the handmaiden stereotype. I actually think all of the stereotypes of nurses are represented somewhere in just this 4-issue series. Linda Carter continues as Night Nurse in a different incarnation in the Daredevil comics, where she's a Battleaxe nurse who specializes in helping injured superheroes without asking a lot of awkward questions. Another main character, Christine Palmer, appears as the love interest in the Doctor Strange movies, where she is played by Rachel McAdams. By that time, they have changed her career to surgeon, and that's pretty common that the more capable nurse characters are very often depicted as being on their way to becoming doctors. The public perception of nurses impacts the way working nurses perceive themselves, the way they are treated by coworkers and patients, and the decisions of students about whether or not to go into nursing at all. Ignorance of what nurses do makes it harder for us to get adequate staffing and pay for our work because nurses are not given credit for the unique skills and training they offer, which further impacts recruitment and retention in the field. Images that we see in the media impact the way we perceive reality, even for people who consider themselves to be media aware. We all understand that the world is too complex for media to portray it all. Media boils that complexity down so that it is easier to deal with. However, what remains creates a social statement. Males account for only about 9% of American nurses, a number that is shockingly similar around the world. Despite the fact that dis- Despite the fact that early nursing in Europe was as likely to be performed by monks as by nuns, the portrayals of male nurses in media align with the stigmatizing experiences that real-world male nurses report. They hear from others that it's women's work. You must be doing it so you can become a doctor. I am not comfortable with a male nurse examining me. Nursing is consistently associated with homosexuality for men, and sometimes they are even seen as sexual predators. Patients frequently state that they prefer being cared for by a female nurse. Male nurses in many places struggle to even find clothes to wear because nursing uniforms provided by facilities are frequently designed for women. Greg Fokker from Meet the Parents is a perfect representation of this issue. Throughout the film, he is belittled and emasculated by his soon-to-be in-laws for his career choice. Although Greg himself seems confident in his choice, he is pushed to the point of avoiding even telling his girlfriend's ex what he does because of the response that he knows it will evoke. Male nurses believe that the way they are portrayed in media contributes to stigma and decreased success for men in nursing. Men are less likely to enroll in nursing programs, less likely to graduate, and less likely to stay in the profession. However, it is notable that they are also seen as better at management than female nurses and leadership, and they are disproportionately represented in nursing management roles. For years, the world has been plagued by a shortage of nurses. This image from the Saskatchewan nurses' strike of 1999 shows a moment when over 8,400 nurses in the Saskatchewan Union of Nurses held a shoe-in at the legislature to represent nurses leaving the field because of unsafe working conditions, forced overtime, and chronic nursing shortages. The nursing shortage has only worsened since this time and has led to loss of patient lives and severe strain on nurses, leading more to leave the field. It is anticipated that the American demand for RNs will increase by 5% over the next 10 years, and in that same time frame, 25% of current RNs plan to retire. The WHO has identified the media representation of nurses as a factor that contributes to low enrollment in nursing schools. Income for nurses have remained flat, which also impacts recruiting into the field. But making the argument for higher pay is difficult when no one really understands what you do and thinks that it's either menial tasks or magical angel work. Inaccurate representations of nurses can contribute to ill treatment and poor attitudes toward nurses from patients and other professionals. Female nurses experience more sexual harassment than their male counterparts. The primary perpetrators are patients, followed by physicians. This issue is not infrequently portrayed in media. However, we are usually supposed to find it humorous. The first scene in which Nurse Carla appears in Scrubs includes a reference to the attractiveness of her breasts. And she responds, "Oh, that's so sweet." When Surgeon John Trapper first sees Nurse Major Margaret Hot Lips Houlihan in the MASH movie, he points at her and declares, "Bring me that one over there, that one, the sultry bitch with the fire in her eyes. Take her clothes off." Throughout the show, Houlihan is punished for her unwillingness to provide sexual favors and entertainment for the life-saving work that the men are providing. She is subjected to ruthless sexual harassment and humiliating pranks, and we're supposed to feel like it's all in good fun. The two other stereotypes that I did want to mention are the doctor wannabe and the absent nurse. I think they can be seen as subsets of the handmaiden stereotype. Like many other capable nurse characters, Carla on Scrubs is depicted as someone who wanted to be a doctor, but falling short, became a nurse. Christine Palmer of Night Nurse is promoted to surgeon by the time she reappears in the MCU. Claire Randall of the Outlander books begins as a nurse in the series, but when she reappears in book 2, has become a doctor. The message in these examples is clear. Being a nurse is not enough. The real goal is to become a doctor. The distinction between the jobs, the unique role that each provider can play in patient care, all of this is dismissed by this messaging. Of course, potentially the most damaging representation of nurses is that we don't exist at all. Dr. House famously tells his doctors that he doesn't want nurses doing any of his patient care. Grey's Anatomy shows doctors leaping into action and performing all sorts of care that nurses would normally be busy doing. Nurses greatly outnumber doctors in nearly all settings, making up more than half of the global healthcare workforce. Their absence in these different media sends a message that their presence isn't necessary. We don't see nurses performing these cares in media, and we overlook them in real life. Real nurses, like my cohort of students who just graduated this past spring and entered the workforce, are impacted by these incorrect portrayals of nurses. The nursing shortage reduces the quality of care provided by nurses at all levels of care, which puts patients at risk and strains the healthcare system overall. We must work toward gaining a better understanding of what nurses do so that we can better appreciate their unique and critical role in the healthcare system. And I do have some references here at the end, as well as some information about other sources that you can go to learn more about this issue, and I can post those in the comments. And then here is my QR code if you would be willing to fill out a survey for me to give me some feedback on the content of this presentation and on me as a presenter. Thank you for watching.